Magandang araw po sa inyong lahat. For today, I would like to discuss with you or orient with you the Administrative Order number 2022-0020 or the updated standards on the per capita budget for inpatient meal allowance in all government health facilities. I am Ms. Josephine Giao, Development Management Officer for Dietary Advisor from the Health Facility Development Bureau. So, the administrative order was approved last June 30, 2022. It took us, I think, 1 year in the development of this administrative order in collaboration with Philippine Institute of Development Studies and Food and Nutrition Research Institute, Department of Science and Technology. But before that, I would like to discuss the outline of presentation. The first one I would discuss is a brief overview of the policy impact analysis and the updated policy contents. These are the main topics I will present for today. So, but before that, as an introduction, I would like to orient you or discuss with you about the Health Facility Development Bureau. The Health Facility Development Bureau, or the HFDB, is under the Department of Health Policy and Infrastructure Development Team, or the HPIDT, which is led by Undersecretary Lilibet David. The HFDB is headed by Director Maria Teresa Vera, has an administrative order and 3 functional divisions, namely Policy Planning and Program Development Division, the Health System Development and Management Support Division, and the last is the Research and Performance Management Division. This is all about the Health Facility Development Bureau, our office. Okay, as a background, before dive into the specific of the policy, let me express our deepest gratitude to our partner institution, namely the Philippine Institute for Development Studies, or PIDS, and the Department of Science and Technology, Food and Nutrition Research Institute, and all the hospital nutritionists and dietitians who took the time, who became very active in the entire process of policy assessment until policy formulation to update our standards. The policy impact analysis, what it's all about, last year, the Health Facility Development Bureau, in coordination with PIDS and FNRI, conducted a policy impact assessment of Administrative Order number 2016-0020. 5 years after its implementation, particularly its impact to the quality of nutrition service and food being served in our government health facilities, with a total of 193 Level 1 to Level 3 hospitals from National Capital Region, Luzon, Visayas, and Mindanao. Okay, based on the study, only 40% of the hospital were able to comply with the prescribed energy intake and 51% of hospital being able to comply with the prescribed cost. So ito yung initial result during the study. Okay, but what is interesting is that despite the non-compliance to 150 pesos, there is generally perceived insufficiency of 150 pesos to cope with the factors. So ito yung mga non-compliance. So the policy is generally attributed to limited budget provided to the hospital, higher cost of goods in the area, and the nutritional requirement can be met with a budget less than 150 pesos. Okay, so the health facilities identified numerous factors linked to non-compliance. The first one is the inflation of commodity prices. cannot provide nutritional requirements, and then the meal plans are adjusted to keep all necessary food groups, and the COVID-19 extra disposables. Nagkaroon po tayo ng additional costs sa mga other equipment or materials na ginagamit natin sa nutrition and dietetic service, especially for the COVID-19 extra disposables na dapat talaga disposable lahat ang gagamitin sa ating mga pagkain. Okay, the general recommendation and direction for this policy, for the policy content, a clearer guidance on the overall process of adopting the policy, stronger and monitoring and evaluation structures, and also on the compliance to standards. We should provide a training on menu cycle planning and standardized recipe, since majority of the hospital included in the research doesn't have standardized recipe to use. And then identify enabling factors and mechanisms, especially for local government hospital. Ito po talaga ang mga LGU hospital ang hindi nakakasunod dun sa 150 pesos na recommended for the AO 2016-0020. And then on addressing factors affecting compliance to standards, advocate for the use of more efficient procurement processes. Okay, so what is this AO 2020-0020? The other AO we had in 2016 is the AO 2016-0020, and nakakatuwa po na pag-approve ni Secretary Duque ang AO no June 30, 2022, the number of the AO is AO 2022-0020. Parehas silang 0020, kanya hindi po siya mahirap tandaan. So updated standards on the per capita budget for inpatient meal allowance in all government health facilities. So ito yung naman po ng AO natin na parang summary of the AO. It provides well-balanced, proper meals that meet the PIDRI requirements, and then institutionalized processes in standardized recipes and cycle menus and earmarking costs of meal allowance. It incorporates nutrition standards in procurement plans and bidding documents, capacitate staff with in-house learning and development intervention on cycle menu, standardized recipe, food safety and quality budgeting and procurement. So you can read all about this administrative order. Just download it with bit.ly/hfdb-news. So dito po makukuha po ninyo ang copy nitong ating AO. So, ano po ba ang laman? Anong objective, anong scope and coverage nitong AO number 2022-0020? The objective of this AO is to update the standard on the per capita budget for meal allowance to comply with the nutrition standards, ensure safe quality to prevent malnutrition, boost immunity, and improve recovery of patients and or residents in government health facilities with inpatient and or custodial services. So, sino-sino ba? Anong scope ng coverage po nitong AO na to? All government health facilities, including Department of Health hospitals, the local government unit, Philippine National Police, Military Hospital, National State University Hospitals, medical centers, sanitaria, treatment and rehabilitation centers, and other custodial facilities, and government-owned and controlled corporate specialty hospital. Ito po ang scope and coverage po nitong AO na to. So, what is new with the AO 2022-0020? Unang-una, yung concrete process for menu cycle development. meron tayong provision stating the menu cycle development, and then the process of earmarking, and then updated the food and nutrition standards. It is included in this AO, and then updated tools for better compliance to standards. And then we have this concrete monitoring framework na nakasaad po dito sa ating AO 2022-0020. So, regarding the concrete process flow, unang-una, we have the cycle menu development. So, yung unang-unang ginawa, nagpagawa kami ng 3-day cycle menu for all the hospital involved in this research or in the development of this AO. And then we have this component of the cycle menu. And then we have the template, and also we have the format. Under the earmarking process, we utilize calculator and cost inclusions. We have emphasis on efficient procurement process. It all stated the concrete process flows in this AO. The updated prescribed standard of nutrition, we have the general population and the person who use drugs. And then we have this classification of age group, and then the calorie content per pinggang Pinoy. We have the protein, fat, carbohydrate, and sodium content of the food. And then for children, we have 3 to 5 years old. We have 6 to 9 years old, 10 to 12 years old, and then for adolescent, 13 to 18 years old, and for the adult, we have 19 to 59 years old. And then for elderly, for the general population, we have 60 years old and up. And then we have also a calorie content for the pregnant and lactating for the prescribed standards of nutrition. And then for the person who use drug on the treatment and rehabilitation center, we have also this age group, pinggang Pinoy, protein, fat, carbo, and sodium. And then for the adolescent, it is included the 13 to 18 years old who has 2,535 kilocalorie per day. And then for adult, 15 to 69 years old, 2,000 kilocalorie. And for elderly, 70 years old and up, 1,800 calorie. For the sodium content, this is the computation on how we get the recommended sodium for children. Okay, tools for better compliance to standards. So we use the Menu Evaluation Plus or the Menu Eval Plus of the Food and Nutrition Research Institute as prescribed. The use of the Department of Science and Technology and Food and Nutrition Research Institute Meal Evaluation Plus. This tool will help user evaluate their menu in terms of calorie content and also help the nutrition and dietetic service in preparing cycle menus. In computation of the cycle menus of the prepared food at the nutrition and dietetics, this is also very useful for determining the calorie content, the macronutrient and micronutrient content of the food based from the Menu Evaluation Plus. And then tools for computing the prescribed budget. So this is the content of the tools for computing the prescribed diet. We are now on the part for the computation of the prescribed budget. So we have this background. The budget calculator was created to assist the health facilities in computing for the prescribed budget for inpatient meals in line with the Administrative Order 2022-0020. The calculator automates the calculation depending on the following. Ito po yung mga dapat tandaan based from the regional context, the caseload of the facility, the average length of stay of the patient. So, nandito po lahat, and then nandito yung calculator. What you can do is nandun yung tab and then just click it. And then for the budget calculator, nandito po, nakalagay dito, nandito yung provide the general description and instruction using the tool. For the hospital calculator, the calculator to be used by the hospital, the TRC calculator to be used by the Dangerous Drug Abuse Treatment and Rehabilitation Center, and then the contains data set for the hospital, and then the contained data set for the DATRC or the treatment and rehab, and then also the narrative for the basis calculation. So, ito po yung i-click po ninyo in order to get this, the https, and then the colon bit.ly/inpatient budget calculator. Ito po yung unang-una po ninyong makikita at nakalagay po ito sa ating AO 2022-0020. Okay, paano automates calculation for inpatient budget? Anong unang-una? So step 1, ang unang-unang gagawin nyo is to choose the region when your facility is located. Anong region ito from the survey? And then note, the food cost will be adjusted depending on the region. And the regional adjustment was based on the consumer price index. So ito yung unang-unang step para sa calculation ng inyong inpatient budget. And then for step 2, ito yon. Dapat alam ninyo yung average, input ng average length of stay. Data can be extracted from the Hospital Health Information Management Department, yung HHIM, yung sa medical records natin. Doon natin yan makikita. So ito yung pangalawa. And then for the third step, ito yung input estimated patient per population. So ito yung projected patient caseload for 2023 na. Ito yung ilalagay natin. And then the input estimated, this is the third step for the automates calculation for inpatient budget. So nandito yung children, adolescent, adult, elderly, pregnant women, and mothers. Not like before, during the first AO 2016-0020, we are only confined for the adult. Doon lang po tayo nakafocus noon with the 150 pesos budget for a whole day with an equivalent of 1,800 calories. So this time, meron po tayong children, adolescent, adult, elderly, pregnant, and lactating, which is very comprehensive. So, nandyan po yung step number 3. And then, for step number 4, ito yung calculator will generate the projected budget based on the inputs. Pag nakuha nyo na yung target calories, given po ito standard yan. So itong children, ito yung nakamap na projected caseload for 2023. Sa 3 to 5, 500, 6 to 9, 140 sa 10 to 12. So yung average length of stay ng mga pasyente is 6 days. So ang packaging, given ito, 18.8 pesos, and then ang utilities is 7.50%. So ano yung calculator will generate the projected budget based on inputs. Ito yung budget projected for food costs 2023 and then based from the cost population. So HFDB to update, please be informed that the Health Facility Development Bureau, our office, will update annually to adjust for the inflation. Okay, so consideration in computing the cost and adjustment, nutrition standards, the different target for different population group, the food costs they generated from 2021 cost data, and then please be informed that the overhead utilities earmarked at 7.35% relative to total food cost, ito yung kanina. And then for the packaging and cleaning costs computed for 18.8 pesos. And then the regional prices and inflation rate based on the consumer price index. So ito po yung detalye sa pag-compute ng cost adjustment ng ating budgetary meal allowance. So, cost comparison, ito po yung comparison, no? On the 2016 standard, ito yung population na ginather natin. And then for the 2016 standard, ang cost noon is 150 for an adult with the calories of 1,800 calories. So ito na yung updated standards for 2022. And there are difference po talaga sa pag-compute nito. Kagaya nito, sa 3 to 5, 188.70 for 13 calories, and then for 6 to 9, 217 and all. So, ito po yung cost comparison with the 2016 standards. Okay, for the defined monitoring framework, ang policy and governance, ang target po natin is the presence of an internal policy in the adoption of the administrative order. The health facilities receive technical assistance from the Center for Health Development. And then for the activity, crafting of an internal policy. So, pagdating sa ating mga hospital, interpret nila yung AO and they should also have crafting their own internal policy and then provision of technical assistance. And then the indicator for this, percent of facilities with an internal policy and percent of health policies receiving technical assistance from the Center for Health Development. And then, under also for the monitoring framework for the implementation and process, these are the target. Cycle menus are prepared based on the process described in the Nutrition and Dietetic Service Manual, 3rd edition. Strict use of standardized recipe. Kasi mahirap po talaga na wala tayong standardized recipe na ginagamit ang ating mga cook. At the same time, even sa determining ng ating cycle menu, mahirap po talaga na walang standardized recipe. That's why we have planned to have a future trainings or learning and development intervention or capacity building wherein we will train again the nutritionist dietitian and the cook, especially the nutritionist dietitian, for the development of the new standardized recipe and how they can use it efficiently in their hospital nutrition and dietetic service. And then another is efficient and effective modes of procurement. Since ang mode of procurement ng mga hospital, majority kung minsan nag-fail, bid failure kanya, nagugo sila sa ano nga ba tawag to? Nagugo sila sa shopping, which is not good. Kaya dapat talaga, meron talagang effective modes of procurement. Training in collaboration with the procurement service of the Department of Health is also one of the future activities of the Health Facility Development Bureau, wherein we can discuss religiously the RA 9184 or the procurement law, and then the activity and the indicator. And then for the meal allowance per capita, definitely the target are the health facilities earmarked, the inpatient meal budget at stipulated in the order. The activity are the earmarking of the inpatient meal budget. And then the indicator, actual per capita per day budget for inpatient meals, and then percent of hospitals meeting the earmarked budget, and the reasons for non-compliance. And then, as I said earlier, for the capacity building or the learning and development intervention or training, the target, we want to target the nutrition and dietetic services staff receiving capacity building activities. The activities is the attendance to the learning and development intervention. So ano tong mga indicator na to? We should have frequency of learning and development intervention for R&Ds, food service worker, for efficient procurement practices, efficient menu planning, and then health facility providing in-house LDI and the present health facilities with budget support to nutrition and dietetic service. So ito po yung defined monitoring framework ng ating policy. Okay, and then I would like to discuss other health facility development program of the Department of Health. So here are the other programs or systems and so forth, programs of the Health Facility Development Bureau. For the system, we have this Philippine Health Facility Development Plan. We have the primary care facilities, the healthcare provider network, and then the system on the specialty centers. For the programs, we have this patient safety, infection prevention and control, people-centered care, healthcare waste management, laboratory network, geriatric healthcare facility, green and safety healthcare facility, and also the IHOME, the Integrated Hospital Operation Management Program, wherein the hospital and nutrition and dietetics is incorporated. And then for the projects, we have Health Facility Research and Policy, Innovation Hub, Veterans Ward, Establishment, Hospital Scorecard, legislation on health facility development. And then for the databases, we have hospital financial reports, hospital scorecard, hospital development plans. So ito yung mga other program, system, and projects and databases of the Health Facility Development Bureau. As you can see in the slide, this is the latest third edition of the Hospital Nutrition and Dietetic Service Management Manual that you can use as a Bible or as a reference in your nutrition and dietetic service. We have Department Circular number 2020-0289 or the circulation of the Hospital Nutrition and Dietetic Service Management Manual. You can download this manual on this link, https:// and then /bit.ly/DOH-hfdb manuals. And then for the Department Circular for the cascading of the Hospital Nutrition and Dietetic Service Manual is the Department Circular number 2021-0206. And then you can download, or there is a code here, the https://bit.ly/NDS manual video. We're very thankful to everyone, especially in the development of this, and of course to Secretary Duque for the approval of this AO, that 2022-0020, the updated meal allowance AO for the hospital, nutrition, and dietetics. We're very thankful to PIDS and also to FNRI, DOST for collaboration with us when we do the research. This is a research turned into a policy. So talagang very comprehensive. At the same time, nag-research muna kami dito bago nagawa itong policy na to. So that's why alam namin po na due to inflation rate, malaki ang gastos natin, especially sa ating mga nutrition and dietetic service na nahihirapan ng mag-isip regarding their how to manage the budget and the nutrition and dietetic service for the food of the patient. That's why through this AO, makakatulong po ng malaki sa ating nutrition and dietetic service. So with this, I think that's all. We're very thankful with my division chief, Dr. Terence Jan Antonio, for the guidance and support in the development of this AO. to Director Vera for her support, and also to my companion, si Ma'am Maika Galat, and also Rodan Lebrino, na tumulong sa amin regarding this, and all the technical working group who help us in the development of this AO. Maraming salamat po. Hindi ko na po kayo masabi isa-isa, but we're pero on the bottom of our heart, we're very thankful for the development nitong AO na to. That's why mayroon na po kayong magagamit para ma-adjust ang budgetary meal allowance ninyo sa inyong mga hospital. Again, maraming salamat po. And then, regarding, you can contact us. This is our address, Hospital Nutrition and Dietetic Service Management. We are under the Policy Planning and Program Development Division, Health Facility Development Bureau, DOH, and our building, we are at the building number 4, San Lazaro Compound, Rizal Avenue, Santa Cruz, Manila, and our contact number is 865-178-00, local 1401 to 1407. So ito yung mga code na pwede ninyong gamitin na you can contact us regarding this. So with this, maraming salamat po for taking time in listening listening to my presentation, and hopefully you will learn a lot out of this presentation. Again, maraming salamat po sa inyong lahat.